Welcome aboard the Bitcoin Express. My name is Chase. Let's get to it. Blockchain will revolutionize healthcare. It will reduce medical errors, save lives, and make everything so much more convenient for patients and for providers. Blockchain is just another database. It's a way of storing information. We usually think of blockchain, we think of cryptocurrency, but it's just a way to store transactions and store information. And this is very important and will help the healthcare industry. And the area that it will have the biggest impact on is reducing medical errors and preventing medical errors, deaths related to medical errors. A recent Johns Hopkins study claims that 250,000 people in the US die every year from medical errors. And most of the time, these medical errors are due to a lack in sharing information. Most patients, most people, they don't have one provider. They have a few doctors, they have a few therapists, they go to a few clinics or different hospitals, and information can easily be lost. A surgeon might be performing a surgery on a patient, and they might be unaware of a very important medication that patient is taking. But with blockchain, and in this case it would be a permission blockchain, all the information can be on one ledger. So there's no need for doctors and nurses and therapists to call and email and figure out what is this patient about? What is their medical history? It can all be in one spot. So not only will this reduce medical errors and save lives, it will also make the whole process of healthcare so much more convenient. If all the information is already on a ledger, you don't have to fill out a new form every time you go to the doctor. I know most people get very frustrated. Every time they go to a new provider, they have to fill out a sheet over and over and over again, providing information that they have provided thousands of times. Not only is this inconvenient for the patients, it's also inconvenient for the providers having to go through this information where with blockchain, if it's all on a ledger, they already have this information and now they could focus their time on providing better patient care. So on top of this area of a lack of communication with providers, this disconnect, this lack of communication also affects medical researchers. All the information is segregated. When someone or a company is doing medical research and they need to share that information with another company, there's a whole disconnect, it's a whole mess. But with a blockchain ledger, again, a permission ledger where everything is in one place, companies, medical researchers, doctors, scientists, they can all share their information, and this will lead to greater developments. And a very important feature about a permission blockchain is that information does not have to be given. When it comes to a patient, they'll have the option to refuse giving their information. They can give partial information or they can give all their information. Same thing in this case. Let's say there is a pharmaceutical company doing medical research and they want a competitive advantage. They don't have to share their information, but if they want, they can share partial information to the blockchain or they can share all their information to this permissioned blockchain. Another place that blockchain will help in healthcare is preventing future pandemics, or at least limiting future pandemics from spreading across the world. Right now, the World Health Organization has launched a blockchain platform to fight COVID-19 alongside IBM, because when it comes to pandemics, early detection is the most important thing. But right after early detection, the next most important thing is sharing that information with other people and other countries. We all know that in the beginning of COVID-19, there was poor communication. There was a lack of communication. And this is how the virus spread across the world. But with this system, again, on one ledger, everyone can see it. Not everyone, but if you are permissioned to be on this ledger, so governments, health organizations, they'll be on this ledger. They'll have all the latest information and up-to-date information on the virus. Even today, as we're trying to communicate across the world, it's still a little difficult for everyone to be on the same page or on the same ledger. So this definitely will change the way we look at pandemics in the future. And the last place that I wanted to talk about when it comes to blockchain and healthcare is reducing counterfeit drugs. And this would be done using blockchain, more specifically supply chain. This is the process of following a medication from its creation all the way until it reaches the patient. So it can be tracked where it was made, where it was transported, who sold it, and what hospital now has it. So by doing this, you can track along the way, was there anything suspicious? Maybe this medication isn't real, and you'll be able to detect right away where that mistake was made. But even if you're working with a medication that is not counterfeit, it's a real medication, it was not tampered with, sometimes medications can have issues. And with supply chain, everything is on this one ledger, and you can look at it and you can find out where the mistake was made and you can fix it immediately. Now, all of these things I went through, they are amazing and they will save lives, they will make things safer for patients and make them more convenient. But there is one major issue, and right now at the moment, that is the issue of privacy. When it comes to healthcare, especially in America, there are HIPAA laws. These are privacy laws where medical information of patients must be kept private. This is very sensitive information. It can only be released with the permission of the patient. If an organization or if a provider somehow leaks this information, even by accident, they can be fined or they can even lose their license. So although we have the technology of blockchain at the moment, we still have some time until it's actually being utilized, because we need to conquer this issue of privacy and make sure everything is 110% private. And you might be wondering, we're using blockchain, how can it be private? Because you might be familiar with maybe Bitcoin or cryptocurrency, and it's decentralized, it's public, everyone can use it. Well, when it comes to blockchain, Bitcoin and cryptocurrency, it's only a subset of the whole blockchain ecosystem. There are different kinds of blockchains. There are public ones, which you might know of. There are private blockchains. There are hybrid blockchains, which use a little bit of the public side and a little bit of the private side, and consortium blockchains, where different organizations work together. So when it comes to healthcare blockchain, it will likely be a consortium blockchain of different companies and organizations working together. So it might be governments, it might be hospitals, it might be clinics and providers, and they're all on one shared ledger that is known. So everyone has an identity. There's nothing anonymous about this. If you're interacting with these permission blockchains, your identity is known. And also, you cannot just have, not anyone can be on the blockchain. You need to have permission to be on the blockchain. And if you are a participant or a patient, you have the right to refuse providing your information. You can give partial information, or you can give all of your information. So as you can see, blockchain will revolutionize the way that we do healthcare. I hope that you found value in this video. If you like it, like the video below, subscribe to the channel. Thank you for listening, and I'll see you next time.